If you're a man in your 50s, 60s, or beyond, and you've started noticing that your intimate moments feel different, particularly that unmistakable rush of climax is still there, but there's little or no semen released, then I want to speak to you directly today. You might have experienced this only once and felt that subtle jolt of worry deep in your stomach. Or maybe it's been happening more frequently, a quiet, recurring concern you haven't told anyone about. Understandably, it might carry a sense of confusion, maybe even a flicker of shame, especially if you're unsure what this change means about your health or your masculinity. Let me reassure you right now, this experience doesn't mean your masculinity is fading. It doesn't signify the end of your intimate life. More often than not, it simply indicates that your body is trying to tell you something highly specific, and thankfully something we can often manage or correct with the right understanding and care. Before I start, I have an important announcement to make. I'm excited to announce that I'll be offering free online consultations to at least 3 lucky viewers from anywhere in the world, no matter where you're watching from. The consultation will be about masturbation or improving your erection's quality. The selection will be done completely at random using a number generator. To participate, comment your lucky number between 1 and 200 below. And while you're there, hit the like button, subscribe to the channel, and share this video with someone who could benefit, because the more active you are, the more this community grows. Don't wait. Drop your number now and try your luck. I'm Dr. Fiona, a board-certified urologist with more than 12 years of dedicated experience in men's health. And today, we're going to have a candid, evidence-based conversation that could truly bring you clarity, confidence, and a renewed sense of control over your well-being. In this video, we'll cover the primary causes of what's called dry ejaculation, clarify when it might suggest a deeper medical issue, and most importantly, walk through the solutions that modern medicine, supported by the latest clinical research, offers to restore your peace of mind. If you're a man in your 50s, but first, let's look at how this process works when all systems are functioning as intended. Imagine your reproductive system like a finely tuned orchestra. Multiple players have to move in perfect coordination. The testicles produce sperm. The seminal vesicles contribute nutrient-rich fluid to support and transport those sperm. The prostate adds another layer of protective secretions designed to stabilize the mixture. All of this combines into what we commonly refer to as semen. When climax occurs, a beautifully synchronized series of muscle contractions, most notably in the pelvic floor and reproductive tract, propels this fluid out through the urethra. This is ejaculation. It's rapid, precise, and depends on a delicate interplay between nerves, hormones, and muscular control. Now, here's an essential distinction. Climax and ejaculation are not one and the same. Climax is a neurological event, a surge of sensation and pleasure, driven primarily by your brain and spinal cord. Ejaculation, however, is a physical action involving the expulsion of semen. Most of the time, these events occur together, indistinguishable, but they are governed by separate biological systems. So when you experience climax without the expected ejaculation, or with significantly reduced volume, we call this anejaculation, or more specifically, dry ejaculation. And yes, I understand, the experience can be unsettling. It's often described in my office as an empty orgasm. And for men who have always associated ejaculation with intimacy and virility, this gap between expectation and reality can raise emotional alarms. But here's the key truth. Your nervous system can be firing exactly as it should. The pleasure, the connection, the desire, those may remain perfectly intact. What's changed is simply the physical mechanism of fluid delivery. This isn't a loss of manhood. It's a mechanical issue with specific, detectable causes, and many of them are very treatable. Let's break down the 3 most common causes of dry ejaculation, according to current urological research and best clinical practices. First, retrograde ejaculation, when the internal gatekeeper malfunctions. There's a small muscular valve called the bladder neck sphincter, which normally clamps shut during ejaculation to prevent semen from flowing backward into the bladder. If that valve remains relaxed, often due to medication, age-related nerve changes, or certain medical procedures, the semen doesn't exit outward through the penis. Instead, it takes the path of least resistance. It flows backward into the bladder. This process is harmless in itself, but confusing if you're not expecting it. A telltale sign is cloudy urine immediately after climax, because the semen has been redirected and mixed into the bladder's contents. Now, what can cause this? Most commonly, retrograde ejaculation occurs after prostate surgery, particularly procedures like TURP, transurethral resection of the prostate, which can affect the nerves and muscle tone in the area. Certain medications, especially alpha blockers used to treat high blood pressure or benign prostatic hyperplasia, BPH, may also contribute by relaxing the smooth muscle around the bladder neck. The good news, in many cases, this isn't a sign of disease. It's a biomechanical concern, and depending on the cause, it may be reversible or modifiable through medication changes or specific supportive therapies. Second, seminal duct obstruction, when the plumbing is blocked. In this case, the glands are doing their job. Fluid is being produced normally, but the pathways that carry that fluid, the ejaculatory ducts, are blocked. This is often due to a past infection, like chronic prostatitis, which may have left behind scar tissue, narrowing or fully obstructing the ducts. In other cases, tiny calcified stones can form, especially in men with chronic inflammation in the prostate or seminal vesicles. Symptoms may be subtle, a gradual decline in semen volume over time, a noticeably thicker or grainy texture, or discomfort during climax. Fortunately, modern imaging, such as transrectal ultrasound or MRI, can help visualize these obstructions. And depending on severity, treatment may involve anti-inflammatory medications, antibiotics, or minimally invasive procedures that restore normal flow. Third, hormonal deficiency. When fuel levels fall too low. Testosterone isn't just your libido hormone. It directly impacts the function of your prostate and seminal vesicles, the very glands that produce most of the ejaculatory fluid. When testosterone levels decline significantly, a condition we refer to as male hypogonadism, the volume of ejaculate can fall or disappear altogether. But the effects go well beyond fluid volume. Low testosterone can silently erode your energy, reduce your motivation, impact muscle mass, blunt your libido, affect sleep, and even lead to depressive symptoms. According to current Endocrine Society guidelines, hypogonadism is diagnosed through blood work, typically measuring total and free testosterone levels, and when appropriate, treated with personalized testosterone replacement therapy. When managed correctly, this therapy not only improves sexual function, but often enhances overall quality of life, vitality, and well-being. Now, while these causes account for the majority of dry ejaculation cases, I must highlight a critical point as a physician. If this change happens suddenly, without any prior warning, and especially if it comes with pain, fever, blood in the urine, or semen, numbness, or other neurological symptoms, please don't delay. These may be signs of something more serious, such as nerve damage from diabetes, Parkinson's disease, severe prostatitis, or, in rare cases, urological cancers. These situations require a thorough urological evaluation as soon as possible. Let's also acknowledge the emotional aspect. For many men, ejaculation is more than biology. It's linked to identity, expression, confidence. When it disappears without explanation, it can stir up anxiety or a sense of inadequacy. I've seen men start avoiding intimacy, becoming increasingly withdrawn, not because they've lost desire, but because they fear judgment or feel like something's broken. That feeling is real, but here's what I want you to remember. Your worth, your capacity for intimacy, the depth of your connection, they're not measured in milliliters. The ability to feel, to give, and to receive pleasure remains within you. And in most cases, this is a solvable medical issue, not a personal failing. So let's turn knowledge into action. First, don't ignore this change. Investigate it. Seeing a urologist for a conversation, a basic physical exam, and perhaps some simple blood or imaging tests can clarify the cause in most cases. Second, take charge of your underlying health. Conditions like diabetes, hypertension, and high cholesterol don't just affect your heart. They damage the nerves and blood vessels that support your sexual function. And third, speak with your partner, with your doctor. Silence breeds shame, but information, communication, and medical support bring confidence and often concrete solutions. In closing, I want to leave you with this message. Dry ejaculation is not the end of your sexual vitality. It's a message, and it deserves your attention, not your fear. I've seen men walk back into full, vibrant, fulfilling lives once these issues were understood and addressed, with dignity, with expert care, and with the right tools. So don't let confusion become your permanent state. Take action. Get answers. Your best years are not behind you. They're ahead. If you found this message valuable, I encourage you to share it with a friend, a brother, even your father. This is how healing spreads. Tap the like button to let the algorithm know men's health matters, and subscribe to stay informed as we continue to bring you clarity, inspiration, and practical tools for living fully. I'm Dr. Fiona, and I'll see you in the next video. Stay strong, stay informed, stay connected.